Okay, good morning. Today we're going to have a teach back on the nervous system disorders and the musculoskeletal system disorders. And one of the things that you have to realize as future nurses, one of the most common conditions that would normally be seen by you in the hospital setting would be what? Patient who suffers from a stroke, right? Okay. And when you think of stroke, what part of the body is affected? The brain, okay? So that's the reason why. What's another name for stroke, class? What's another name? Cerebrovascular accident, or CVA. Some books use the word cerebrovascular disease, but the idea here is that cerebral means brain, vascular means what? Blood vessels, right? But in the case of these blood vessels we're referring to that affects the brain, which one is it? Artery or veins? Artery. Why? Why the arteries? What do they carry with them? Oxygenated blood. Now remember, every single cell in your body needs what? Oxygen. Do you know why? Why do we need oxygen in our cells and our body in general? What is the purpose of oxygen? Anyone? Okay. So the idea is that we're not just simply here to memorize things. We're here to understand why do we need this, why do we need that, what is it for, right? How is it going to affect us if there is no oxygen to the cell? And remember, when you group cells together, they form tissues, and when tissues group together, you form an organ, like the brain, right? It's like the brain, okay? Or the heart as an organ, or the kidney. And then when these organs group together, you have the organ system, the cardiovascular system made up of the heart, the blood vessels, the blood, the nervous system made up of the brain, the spinal cord, and the nerves, right? So why do we need oxygen in the first place? So there's something that you have to understand. Because if somebody would ask you point blank, what's the purpose of oxygen in the body? Why do we need oxygen? Can anybody tell me why?
For the energy.
Energy, what about energy? Sonia, right? Sonia, Miss Reyes?
For the ATP.
ATP production in the cell, you right? Remember that? And for these to be produced in the cell, what's organelle in the cell is responsible for ATP production? Mitochondria. Okay. Now, if you remember in basic chemistry, we talked about the Krebs Cycle, or what we call the citric acid cycle. All the things we eat, like what? Carbohydrates, proteins, and fats containing food, they'll all be converted to ATP, but at the same time, they end up becoming what? Pyruvate. The cycle, the pyruvate, and eventually you need to produce ATP from these materials, but it is more efficient if it's what? With oxygen. With oxidative phosphorylation in the mitochondria, you end up with more ATP produced, right? So therefore, without ATP, no energy for the cell, and if there is no energy, the cell will die, right? So that's how important it is. And how do we get oxygen? By what? The air around us. What do? We inhale. Okay, everybody inhale. Exhale. Everybody inhale. Okay, please don't fart, okay? And exhale, okay? So the idea therefore is, when you inhale, you bring in air that contains oxygen, and when you exhale, you bring what? Carbon dioxide as considered waste, right? Okay? So, when you're dealing with a cerebrovascular accident, as we said, cerebral means brain, vascular means blood vessels, but in this particular situation, you're dealing only with what? Cerebral arteries, right? And then of course you have your what? It's not really an accident, but as I said last Tuesday in the other class, it means that there is a condition that is not normal, an abnormal blood flow in the brain affecting the cerebral arteries, which either can lead to what? Obstruction to the flow of blood in the presence of a clot in the artery, or in severe cases, an artery in the brain what? Bursting. Okay? You understand? Now, so I know in this blended learning situation or style, you're going to read ahead of time, you're going to do a lot of responses to your peers when you make your discussions. The idea here is that we want to know how much you have understood of what you have read, right? Now, my role as a teacher is to explain things. My role is to explain so that you will hopefully what? Understand more. And when you understand more, you will what? have a better appreciation of the things we do here, so that when you take the core nursing subjects, you'll have a better preparation. And not only that, our main goal is to make you pass the nursing board exam, right? NCLEX. And as I mentioned to you before, this particular class is a very good indicator. If you get an A in this class, 93% or higher, absolutely, you will pass the board exam. And as I make a joke about it, you will be able to pay your student loans, right? And you can buy 5 cars and 10 houses in Vegas, right? Okay. You understand? Now, so CVA. There are different types of strokes, right? Or cerebrovascular accident. One that leads to a brain infarct or ischemia. As we said, it involves the brain, like this one here. And it is, you can find that the brain has what? Arteries, right? Why are they red? Because they can carry what? Oxygenated blood, arterial blood, right? So the cerebral arteries carry oxygenated blood, right? And apparently, as you can see, they are found on top of the brain or inside the brain itself, right? See? So this is the brain. You have arteries there, right? Like this. I'm just trying to expand an artery. If you remember, the artery has 3 layers in its wall. Tunica intima, right? The first layer. There's a lumen here, or space where the blood will flow. Tunica intima followed by what? Tunica media. And the last layer would be what? Adventitia. So tunica means what? Layer. So intima. Next is what? Media, and the third one will be what? Adventitia. The idea, therefore, is that these layers are found in the wall. Now, remember on the lecture on atherosclerosis, as we get older, and especially if you're not careful with the food you eat, what happens? There is deposition of what? Of fat in the tunica intima, and that is called atherosclerosis, right? Okay. So can that also happen in the arteries of the brain? Yes. Remember when we talk about coronary artery disease or ischemic heart disease, it was the same pathology. There was deposition of fat in the wall of the coronary arteries leading to chest pain. The same thing here. When fat deposits here on the wall, what happens to the lumen? Decreases. Remember the resistance and formula that we discussed before? The moment the radius decreases, resistance goes up, and what happens to the blood flow? Less, right? So as you decrease the lumen size, you decrease what? Blood flow. And we call that what? Ischemia, right? Okay, do you understand? Now, what happens if that blood flow gets slower and slower because the fat deposit gets bigger and bigger? Will there be a clot that can form? Definitely, a clot could form. And the moment you have a blood clot there, what can that clot together with the fat deposit do? It could completely what? Block the flow of blood. The moment there is lack of blood flow there, guess what happens? What happens to the cells? They die. It's called infarction or brain infarction, right? Do you understand? So apparently, when that happens, that area of the brain will die. And correspondingly, you have all the signs and symptoms, right? You understand? Okay. So for example, a patient has an infarct due to a blood clot. If you remember, the left side of the brain controls what? The right half of the body, or the contralateral side. The right side of the brain controls what? The left side of the body, or the opposite side, or contralateral side. Why? Does anybody remember? Anybody remember? Yes?
The nerve fiber tracts.
What about the nerve fiber tracts?
They pass to the opposite direction.
Where does it happen?
Medulla oblongata.
Very good. So, if you were to compare them into what? Telephone wires, right? Telephone wires, the nerve fiber tracts in the brain and spinal cord. If this were the right side, the nerve fiber or telephone wire tracts would go from the right, go down to the right, then what? Cross to the opposite side in the medulla oblongata, which happens to be what? The last part of the brain. Okay? And apparently, it causes on the left side and then start to go down where? On the left side of the spinal cord, and all the spinal nerves and the peripheral nerves on the left upper limb and left lower limb actually came from where? From the right. Okay, so in other words, the right side of the brain controls what? The left side of the body. At the same time, the left side of the brain controls what? Right side of the body. Okay, so what is the term used when half of the body is paralyzed? Like left upper limb, left lower limb is paralyzed. What do you call, what's the term we use? Hemiplegia. Hemiplegia. If it's complete paralysis, like, you know, there's no movement or maybe just one grade, like this. Yeah? On the other hand, you say hemiparesis, Hemiparesis. What does it mean? Partial paralysis, which means I can, it's like this, see? And I have a tension to drag my foot, like this, right? So the idea, therefore, is that when there is lack of blood flow, or when the brain cells in that right side of the brain is affected, you have left hemiplegia. If you have left-sided lesions affecting blood flow in the left side of the brain, you end up with what? Right hemiplegia. Do you understand, class? Okay? So therefore, this might come out in the nursing board exam, right? So if they say a 70-year-old male patient was brought to the emergency room with right hemiplegia, then they would ask, where is the lesion in the brain? The answer would be what? The left cerebral hemisphere. If you remember, the motor cortex, the part of the brain responsible for controlling our movement, is found in what lobe? Frontal lobe. Do you remember the specific area in the frontal lobe where you find the primary motor cortex? Anybody remembers? Okay, the answer to my question, is it okay if I answer my own question? It's called the precentral gyrus of the frontal lobe, right? It's called the primary motor area. Precentral gyrus. Remember, our brain has gyrus and sulcus. The gyrus is the fold, like this one here. And what do you call the groove or the canal? It's called what? Sulcus, right? So this one here, see the groove? Sulcus is called the gyrus, the fold, right? So the idea, therefore, is that the precentral gyrus of the frontal lobe is where you find the primary motor area. The one, and then all these pathways, just like telephone wires, originate from there. And then if you have right hemiplegia, then any part of that pathway could have been involved in a stroke like this. Okay? So, and as I have told, if you have watched the video for how many of you watched the video last Tuesday? Okay, you are at an advantage. Don't tell the other class, okay? Because they have nothing to say. Well, they have the old ones. If they are really resourceful, and if they have subscribed to my Joel Gamo MD YouTube channel, it's free, then they'll find out that there are a lot of teach back also, like similar to this, that were in the past, right? Like last term and the previous term. So essentially, I talk about the same thing. The only thing is that what I said last time may not be the same what I said today, because sometimes my brain I forget certain topics, or I might even add something that was not mentioned in the past, right? So the idea is that if you can watch all, why not, you know? So the bottom line now is that let's try to do A1. And I told this to the other class. One of the things that will help you learn something is what? Being very organized. Okay? What is that at the door side? That's a trash can, right? What do you put in a trash can? Garbage, right? The same thing with your what? Your brain. Okay? Your brain has a limited capacity to store information. So whatever you read in the book, you have to discern which one is important, which one is not. What will be your guide? Well, based on the syllabus. Second, what else? Remember, at each chapter, there is always what? At the beginning of the chapter, that says, at the end of this chapter, student must be able to, let's say, 1, differentiate a thrombotic stroke, embolic, or hemorrhagic stroke. So that will be your guide. That's your gold standard. Hey, I need to know this. That's what I'm supposed to know. That's the gold in that chapter, right? Number 2, I should be able to differentiate and compare the different signs and symptoms of Parkinson's disease and be able to know where the lesions are, right? So that means, should I know about Parkinson's disease? Definitely, right? Number 3, know about multiple sclerosis, the pathophysiology. So that alone will guide you, because a lot of people come to me, oh, I'm lost, I do not know where to begin, I do not know what to do. And what do? They start reading every single word in every chapter. And then at the end of the chapter, what do they remember? And what do they recall during an exam? What, Miss Reyes? So, if you did not retain the information, what would you recall during the exam? Nothing. And what will be your grade, Miss Reyes? Nothing. Well, not really 0, maybe 1 out of 20 or 30. I'm just joking, okay? So do you understand? So you have first to read as a visual learner, understand, comprehend what you read, and also comes with words. The more words you know, the more what? You're able to comprehend, okay? Some of you during an exam, you raise your hand and ask me, Dr. what does this mean? Is that part of the exam? Yes, it is, right? And thirdly, you have to find a way to what? Retain information, recall things. One of the things I usually do is what? Repetition. Another one is by association, right? For example, if I say platelet, blood clotting. If I say blood clotting, what is it? Platelet, right? Okay. Now, if I say stationary clot, what would it be? Hi, my name is Mr. Thrombus. What is your name? Your name is what? Stationary clot. Now, if I say, hi, my name is stationary clot, what is your name? My God, this is a class that is so quiet. I don't know why. The other class every Tuesday night, they're so alive and so noisy, I get irritated. But this class, OMG. In the Tuesday class, you know what? They start talking here, talking. And if I ask them, everybody answers. Everybody what? Participates. So as if, okay. Maybe because of the time. That's Tuesday night. It's at 6 p.m. here. It's 7 in the morning. Maybe you're still. Traveling clot. Embolus. No, it's not your fault. It's actually I would have been sleeping by this time, right? I had to turn on my alarm clock at 4:30, and then I woke up. And I said, "Oh shit!" So I woke up to 5. I said, if I turn it to 5, there's a big chance that I won't even wake up, right? So by 4:45, I was still awake. I said, okay, I might as well stand up or else. Okay, now, the next thing we need to do is, now, where did they put the eraser? Did you see the eraser? Oh, here it is. So you understand the difference between the different types of strokes, right? And clots. So let's go over. So how do you organize? Because if you throw the garbage can, the waste in the garbage, the same thing here. Whatever is not important, throw them away. Aside from using concept maps, which I think I've introduced to you before, we can use tables, right? Tables. One of the best ways to learn things are tabulating things. Tabulate, right? And writing down only the things you need. How many of you have a whiteboard at home? Can this help you learn? Well, of course. Can you imagine if you have memorized your notes without looking at your notes and write them here, and you what? Write this down and then erase and write it down again. How can you forget? Like what I'm doing here, pretend that you're me. And you go home and pretend that you're teaching your dog and your cat. Oh, I'm just kidding. Or your kids. No, not the kids, because if they keep on roaming around and you'll be wasting it. Oh my God, where are you? Oh my God, mommy, I want some milk. Okay. Okay, so CBA. Right? So you have the brain infarcts and ischemia, which involves what? A blood what? Clot. Under this you have what? You can actually exactly classify them as either TIA, thrombotic, and embolic. Right? Thrombotic simply means that the clot form where? This is the brain, spinal cord. The clot form in the wall of the arteries. It's a stationary clot. It's attached to the wall. On the other hand, embolic, what is the most common source of embolus? The heart, right? The left ventricle. How? So another thing you need to know is, again, go back to the foundation of nursing, which happens to be what? Anatomy, right? So we say the aorta is here, ascending, arch, descending. You have the brachiocephalic, divided to subclavian, and then what? Right common carotid. And the right common carotid divides into two, internal and external. Which one do you think will go to the brain? Internal carotid, right? Carotid artery is the one you find in the neck when you palpate, common carotid. Now, so the internal carotid gives rise to what? Your cerebral, the arteries of the brain. You have anterior cerebral, middle cerebral, posterior cerebral arteries, based on the location. On the left side, the left common carotid comes directly from the aortic arch. There is no brachiocephalic on the left side of the body. So IC, which is internal carotid, AC, the external carotid goes to the face. And then of course the left subclavian to the arms, right? And the limbs, okay? So the idea therefore is that whenever there is a clot in the left side of the heart, either left atrium or left ventricle, can that clot travel to the brain? Passing through the 5 North Freeway or the 5 North or 405 North, right? It goes like this. Yes, you can either have, it has a choice. It can either go to the left or the right side. Does that make sense? So, to become a smart critical thinking nurse, you have to have the foundation of anatomy, because if you do not even know, if you cannot even tell me how did it get to the brain, then you will really be what? What is LOST? Lost. And you will simply just what? Memorize and memorize without understanding why. So you always ask yourself, why, what, where, how, right? How did it get there? Through the left ventricle pump, aorta, and then the common carotid. Okay? Why did it form? Now, what could cause a clot to form in the left side of the left atrium or left ventricle? Anybody?
Arrhythmia.
Yes?
Arrhythmia.
And what is an arrhythmia, Sonia?
It's when the muscle cannot, like it's the nodes, the SA node.
There's something wrong with the nodes of the heart. Remember the SA node, AV node? When there is lack of blood flow to these nodes, like when you have coronary artery disease, you end up with an arrhythmia, right? When your arteries of the heart are clogged with fat deposits and there's not enough blood flow to the pacemakers of the heart, the SA node, AV node, bundle of Purkinje fibers, obviously it will affect the beating, right? So instead of, what does A mean? Without rhythm, arrhythmia, without rhythm. So instead of normal rhythm, equidistant, right? You end up with arrhythmia, which means skip beats. So during the time there's a skip beat, like 2 or 3 milliseconds, what happens? It forms a clot. Why? And I think I gave this example in the YouTube video. When I was a young boy, I was very observant. Our house help will prepare the chicken for, we don't, this was in the 60s, so we'll have like something like rough, right? So they get the chicken really from the market. Well, I don't know if it's humane, but of course you kill the chicken to feed us. So while preparing the chicken, the blood flows, right? And because I was such a, I don't know if I was really born to be a scientist, but I would compare the blood in 2 containers. If you put the blood in a container that's empty and another B container, the one in the A, if you move the blood with a stick and the one leave it as it is, what happens to the one that is left behind without doing anything? It coagulates, it clots, right? Same thing here. During the time when the heart is not pumping, remember when the heart is pumping blood regularly, there's continuous motion, continuous movement of the blood. There is never a dull moment, the blood will not clot. On the other hand, when you have what? Skip beats, or when you have what? Atrial fibrillation, or ventricular fibrillation, okay? So the idea here that when a clot is formed because of what? The arrhythmia, okay? So if there's a skip bit, there's no movement, they form a clot. And then the onset of weakness will be what? Very, very sudden, right? So what's the weakness here? Sudden onset of hemi what? What about here? Gradual in thrombotic strokes. Why? Gradual, or what they call step ladder progression of weakness. For example, honey, I noticed last night at 10, it was a little bit heavy on the left side. 12 midnight, I was about to sleep, it was like this. I woke up at 3 in the morning, it was like this. And then now, it's already 7 p.m., I can't even move it. That was gradual onset of paralysis, right? And therefore, that is typical of what? Gradual formation of what? The clot. Clot. Now, what about TIA? TIA stands for transient ischemic attack. What do you mean by that? Transient is temporary. Ischemia means what? Decreased blood flow, which affects the blood flow to the brain cells. So this is the brain, like this. Eh? So there is what? Fat and clot deposits, which causes what? Hemiparesis. Right? Usually it's just partial paralysis. It's not really complete. And there's numbness. But it should be gone within what? 24 hours or 1 day. How would you explain that? We have, in our body, we have certain substances considered thrombolytic. Thrombus is clot. Lytic means what? Dissolve. So they actually dissolve the clot, and once the clot is dissolved, it just get away, so back to normal. So what used to be paralyzed partially becomes back to normal. But that is a warning sign. It tells you that there is a possibility next week or a week or a few days later you will end up with what? A thrombotic stroke. Now sometimes we use the term stroke in evolution, which means you were from this weakness, then this weakness, and then severe weakness, okay? Do you understand? Now, so notice all three of them, what is involved? A clot. So can they be treated with thrombolytic drugs? Remember? TPase, ACE in the heart, streptokinase, albukinase, altipase for this. Why? Because there is what? A clot form, right? Can we give them aspirin? Yes or no? Why? Because aspirin is going to prevent what? Platelet aggregation. What do you mean by that? When this is a blood vessel here, and you have a wound which allows the blood to come out here, the blood comes out, then you have bleeding. The platelet, which are not even cells, are fragments of cells, they group together or aggregate to form what? A plug. It's like when you have sometimes when your hose has a hole, the water comes out, what do you put? A temporary one, piece of cloth or something to prevent. Right? So the same thing here, the plug, the platelets will group together, trying to what? To plug the leaking wall. Does it make sense? So what about anticoagulants like heparin and warfarin? What do you mean by anticoagulants? They what? They prevent further what? Clot formation, but they will not dissolve the clot. Do you understand? Thrombolytic, yes they do. Anticoagulants, they can only prevent further clot formation. Aspirin, they prevent platelet aggregation. Okay. Another name for aspirin is what? ASA. What does ASA mean? Acetyl salicylic what? Acid. Okay. So be aware of these things. As I have said, the more you know, the better for you, and chances of passing is higher. For example, in the board exam, they would say ASA, and you don't even know what is the hell is this. When in fact, it's just the normal one, Bayer aspirin. But you were told it's aspirin, but you were not aware that this is ASA. And you don't even use that as one of your answers. You understand what I'm saying? Okay, now, what about the next one? This is all clots. What about here? Hemorrhage, right? And what happens in the hemorrhage? What happens to the arteries? They burst or rupture. What's the most common cause of bleeding or hemorrhage type of stroke, hemorrhagic stroke? Hypertension. That's the most common. Okay? Hypertension, when your blood pressure is so high, and if you're not properly monitored and controlled by your medication, what is the word poor compliance? What does it mean? Compliance means following doctors and nursing orders on how to take the medication. How often is it possible that the patient, oh, I feel better today, I will not take my medicine for the next 2 or 3 days? Very common, right? Okay. And if their blood pressure shoots up to 200 over 100, can that artery burst? Especially when you what? You strain or do what we call the Valsalva maneuver, such as this, right? Okay. Now I share this with my Tuesday class. That happened to my dad. My dad was hypertensive, and because I was the only son who was a doctor, my other brother was an engineer. So I was on training at the Philippine General Hospital where I was training. I wrote a letter to my dad. I said, I don't want you to suffer from a stroke. Make sure if you are constipated, what do you do? High fiber diet. Second, laxative or stool softeners, which you can easily buy over the counter. I even give him a prescription. And thirdly, even though there's no need, so he knows the drug. And then the third is, of course, never what? Strain. What happens when you do that? If you're constipated, your blood pressure shoots up. So that happened to him. He became paralyzed on the left side of his body, right? Okay. The second one is what? Another cause of what? Ruptured aneurysm. Here, artery will rupture or burst. An aneurysm, if you remember, is what? It is a wall. There's a balloon in the arteries of the brain, right? And some of these are congenital because you were born with it, or it could be acquired because of prolonged uncontrolled hypertension. The idea, therefore, is congenital. Some of these are not even diagnosed until you die, right? Or it could be what? It could be that you have people with recurrent headaches, and what do most doctors tell you what your problem is? What do they say? Oh, you always have a headache. That could just be what? Because we letter M. Migraine, right? Okay. So don't believe them. No, I'm just joking. Get a second what? Opinion. In fact, you can even go to what they call the headache specialists, who are oftentimes what we call neurologists. Okay. When I was in training, and when I was a medical intern, when I went to med school, we had a special clinic for patients with headaches. We called it the headache clinic. And if this headache, why do people have pain? Because there's something wrong with you, right? Okay. So if it's migraine, it's okay. But if it's not, it could be an aneurysm, okay? Do you know that, if I'm not mistaken, the mother of Bruno Mars, she's Filipina, okay? She grew up in Hawaii. She had a ruptured aneurysm, and she died, I think, at the age of 54 or something, very young. Like me, I'm now 58. 8, what day is today? 12? In 8 days, I'll be 58. So I could be like her. If I don't do what I just told you, I keep on straight. And some people don't even know that they have an aneurysm. Some of these, as I said, could be acquired because of prolonged hypertension. How many of you do you get your regular blood pressure? You check your blood pressure from time to time? Me, I don't. So I don't even know if my blood pressure is high or not, so I don't worry. If you die, you die. I'm just joking, of course. Now, can this ballooning of the wall rupture? Yes. When your blood pressure gets higher and you strain, what happens? Burst, the blood will come out. Right? What about AV malformation? AV means what? Arterial veins. Venous malformation. Mal means bad. Which means, if you remember, this is an artery. This is what? What joins the vein? Capillaries, right? Artery or arterial, capillaries, and then the veins or venules, small veins. Normally, what does the pressure do? High pressure, remember the word pressure gradient? High pressure, moderate pressure, low pressure. That's the reason why the blood will flow this way. It is in the capillaries, these are the cells, where they exchange, the red blood cell gives oxygen, and then carbon dioxide goes to the red blood cell. It's also where the what? Nutrients go to, the capillaries. So the glucose, for example, here goes to the capillary, goes to the cell. Whatever waste, like urea, creatinine, and uric acid comes out, especially the things that we need to get out. Okay. Now, the idea, therefore, is when you have an AV malformation or aneurysm or hypertension, can the arteries rupture or burst? It could. Now, what's the danger here? Here, you can also have brain swelling or what we call edema, but which is worse, a hemorrhagic stroke or a thrombotic stroke or embolic stroke? Hemorrhagic stroke. Why? Can anybody tell me why? Yes? Javier?
It causes ICP.
What is ICP? It causes ICP, or is it better to say it could cause an elevation in the ICP, right? Okay. What happens if you have elevation of the ICP? Now, when I ask things like this, it's not because I want to humiliate you. I want you to be prepared to answer questions. Like, how can I be able to understand better this topic if I'm not asked and I'm asked to explain, right? Okay, how is it possible? See, remember what, where, how, when, you know, how is it possible for the intracranial pressure to become elevated here, Javier?
With the burst of the burst of the arteries.
What happens when you burst the artery? Of course, the blood will now get out of the blood vessel of the artery. It will occupy space, right? Where? Inside what? Inside the brain. Now remember, the brain is inside the skull. Now, if you do this to your head, the skull is hard, right? But the brain inside will be what? Soft. So can you imagine if there's blood with that hematoma or accumulation of blood occupy space? Yes. But with the limited space, because there's a skull, the skull is hard. Remember the sutures are fused, it's no longer able to expand. Guess what? Of course, based on the law of physics, the pressure inside would be what? Elevated. It's called intracranial, means inside the skull would be elevated, right? The problem, if it becomes elevated, it will push the brain upwards or downwards. Now remember the skull, at the bottom base of the skull, there is what? The hole called the Foramen Magnum. So it will push the brain towards that area. Now what happens if the medulla is here? The brain is brought down, this is the Foramen Magnum, the hole. What does the Foramen Magnum made of bone do to the medulla oblongata? Compress. And the moment you compress the medulla oblongata, which happens to be what? The part of the brain that controls breathing or respiration, you end up with what? Respiratory arrest. You stop breathing and you die. That's the reason why when somebody suffers a stroke, do we need to do an immediate emergency CT scan? Now CT scan is better compared to MRI scan. Why? You can easily be, within 1 or 2 minutes, you can be ready to have a scan done. MRI scan, it takes maybe 30 minutes to 1 hour to prepare the machine. Now why is it important to do surgery right away? To drain the blood so that you can what? Decrease the pressure and to prevent brain herniation. Because the moment the brain herniates, there's no way you can push it back up. No more. Okay? So the idea therefore is that, you know what's a craniotomy? You drill a hole, you go to Home Depot, buy an electrical drill. No, I'm just kidding. Drill a hole and then what? Let the blood come out. Do you understand? But how do I know where to drill? Because based on the CT scan results. Unless there is a contraindication, okay? Now, the other thing you have to remember too is that, of course, there are drugs to control swelling, like cerebral edema. Edema and swelling can occur here, can also occur here, right? Can anybody know what are these drugs? Now, I don't know if you have read this on your textbook. It's called what? Diuretics. D-I-U-R-E-T-I-C. One of them is mannitol, M-A-N-N-I-T-O-L, okay? So what happened, in simple terms, what you want to do is get rid of the water and fluid inside the brain and allow it to go where? In your wee-wee, okay? So technically, whatever was in the brain will come out where? In the urine. And that will help control what? The brain swelling and edema. Some would give what? Steroids as anti-inflammatory, right? So the idea, therefore, is that you have to act fast, okay? Some of these patients, of course, hemiplegia and hemiparesis could be present. Some of them numbness, right? Some have problems with speech. Now, do you know where is the speech center? Usually it's one on the left side of the brain. My father had his stroke on the right, so he would still be able to speak, but the speech was slurred. Like, for example, if you ask him, where do you live? I live. Okay. Ask me where I live. Let's say I suffered a stroke. Okay. Ask me, anyone.
Where do you live?
Okay. I live in Anaheim, California. Ask for my name. What's your name? Okay, go ahead.
What's your name?
Okay, my name is Dr. Gamo. Okay, ask me how old I am. Okay, I am 57 years young as of today. In 8 days, I'll be 58. I'll be older, right? Okay. So, don't forget my birthday gifts. Okay, now let's say I suffer a stroke. If I suffer a stroke on the left side of the brain where the speech center is found, the speech center is here, I became aphasic, A-P-H-A-S-I-C. Aphasia means inability to speak properly or even talk. Okay, okay, ask me. Where do you live?
Where do you live?
One more time.
Where do you live?
What was I trying to show you? Disneyland, very good. Power words, right? Okay. You see why? Because I cannot what? Now, slurred speech is different. Slurred is what? Like this. Okay, ask me where do I live?
Where do you live?
Slurred speech. In other words, that also means what? Dysarthria. Difficulty in articulating words. Okay? On the other hand, the one I just mentioned, it's called aphasia. Okay? It's called expressive. I understand the question, but I could not express. Global aphasia is like a zombie. You know what I mean? You don't understand, okay? Is that clear? Now, another condition, let's talk about other nervous system disorders, right? In Parkinson's disease patient, what happens in Parkinson's disease patient? The problem is where? In the substantia nigra, which forms the dopamine, right? And then at the same time, it's stored where? In the what? Basal ganglia, your caudate nucleus, putamen, globus pallidus. It's in the middle portion of the brain. Remember Muhammad Ali? Floats like a butterfly, sing like a bee. What happened to him? Because of, the presumption is that because of trauma to his head, he destroyed his substantia nigra and basal ganglia. In Parkinson's, there's a lack of dopamine. Dopamine is a chemical substance called neurotransmitter that is inhibitory. What do you mean inhibit? It controls your movement. So once you lack dopamine, what happens to you? You have tremors. What kind of tremors do you have? Resting or intentional? Resting tremors, right? People with Parkinson's have what they call what? Remember when you work like Tai Chi? Bradykinesia. What is Brady? Slow. V-R-A-D-Y-K-I-N-E-S-I-A. Slow movement, right? Okay? So, like doing Tai Chi. What else? Tremors, bradykinesia. What kind of gait? Shuffling gait. Shuffle. They call it. Well, we also call it, aside from shuffling, in the board exam, it could be festinating. F-E-S-T-I-N-A-T-I-N-G. So you study for everything. You don't just study for this and then something comes out, it's fascinating. What the hell is that? It's actually the same thing as what? Shuffling gait or fascinating gait. What else? They lack facial expression. It's called M-A-S-K-E-D, mask. F-E, what's faces or face? F-A-C-I-E-S, okay. When Muhammad Ali was still in his prime, and I used to watch him, he was in Trilla in Manila in the Philippines, he was very talkative. I'm the greatest, I'm the most handsome boxer in the world. I'm Muhammad Ali. So from Cassius Clay, he became Muhammad Ali. And he goes, I'm the most handsome guy in the world, right? Now when he suffers a stroke, what happens? When you talk to him, there's no facial expression, it's blank. And I think I showed this in the video last Tuesday. It's called what? Reptilian stare. But I think the more appropriate term, reptiles or amphibians like the frog, right? What does a frog do in the pond? You don't even blink. Why? So then when a mosquito or fly passes by, what happens? Can you imagine if that frog would keep on blinking? And the mosquito, oh my God, there's a frog! Go away! Okay? So these patients end up with what they call mask faces. And it's so sad because I idolized Muhammad Ali and he was so, oh man, I'm the handsome guy. And now everybody's laughing, he's still like this. Everybody's laughing, man. Okay, now, and then they deteriorate eventually. Now we give dopamine in the form of levodopa as a good thing with pathophysiology and normal anatomy. You lack dopamine, you give dopamine. The only problem is that it's only good for the first 2 or 3 months. After that, there's no more. And you have to do other things, right? Michael J. Fox, the same thing. Has Parkinson's at the age of, I think somebody said 20 plus. You understand? So there's really a hard cure at this point in time. So maybe stem cell research, I don't know. Okay? Now let's talk about MS. What is MS? Multiple sclerosis. Remember the nerve conduction of nerve impulses. You have what? Neurons, cell body, axon. From the cell body, okay? Myelin, which is faster, without myelin or myelin? Why? Because the nerve impulse will jump from one node, like this, right? So the example I gave, if this is Dr. Gamo here, walking this way as a representation of a nerve impulse, I'll be walking what? Slowly, well, regular, right? But if I am a nerve impulse in axon with myelin, I will be what? Which will be faster, right? So if in MS, it's autoimmune. What do you mean autoimmune? You have a flu, virus, or pneumonia, or whatever infection you had, your body has developed an immune response in the form of antibodies, an immune response which will what? Try to kill the bacteria or virus or the foreign body, but unfortunately, not only will it destroy the foreign body, but it will also what? Destroy your myelin. Now, MS affects what? Brain and spinal cord only. So, whatever part of the brain, now remember the word white matter, why is it white? It's the presence of what? Myelin. What's the color of myelin? White. So, only those that are myelinated axons are involved. Does it make sense? Okay? And we call those lesions in the brain, when you do a scan, it's called plaque. P-L-A-Q-U-E. Did I mention this in the YouTube video? Okay. It's a plaque. Now, here we have what? Periods of exacerbation and what? Remission. So exacerbation means they have all the signs and symptoms. They can even be what? If spinal cord MS here, they can be quadriplegic. Here, paraplegic. Or here, hemiplegic. So sometimes they think it's a stroke, when in fact it's not. Because you can be able to document on the CT and MRI scans. Okay? So what else? It affects mostly what? Women. What else? Between the ages of 20 to 50, and which I think you are in that group age, right? So watch out. Okay? You understand? And of course, if a genetic predisposition, right? Okay? It's autoimmune. 20 to 50 years of age, mostly women affected, but it can also affect men. Does that make sense? Okay, now, there's another form of demyelination. Here it's demyelin, you destroy the myelin. It's called Gbs, Guillain-Barr Syndrome, right? Guillain-Barr Syndrome affects the peripheral nervous system, the peripheral nerves. It affects the myelin. So it affects motor paralysis, numbness, but at the same time, mostly motor functions are involved. It's called ascending paralysis because it starts with what? The feet, the leg, the thigh. It goes up until you hit the diaphragm. With the diaphragm, what happens to be the primary muscle for breathing is affected, guess what? You stop breathing, you could die. Right? Does that make sense to you? So do not take things for granted in these patients, particularly those with GBS. Okay? Is that clear, class? Now, in traumatic brain injury, it's different, right? Traumatic brain injury is due to what? As the term implies, trauma, right? So if you have a baseball bat hit here in the head, it can cause skull fracture, you have bleeding inside the brain. Or when you fall to the ground in an elderly man in a nursing home, you can have bleeding, right? Now there are two common types called epidural and subdural hematoma or bleeding. Which one is more dangerous, epidural or subdural? I know you know the answer now by now. What is the answer? Epidural. Why would it be epidural? It involves what? Arteries. The meningeal arteries. Because these are the meninges, right? If you recall, this is your skull. This is the brain. The first layer on the surface of the brain, which is what? Pia matter. This is the one. And then the next will be what? Arachnoid. And what's the next one? Dura. The space above the dura is called what? Epidural space. The space below the dura is what? Subdural. The space below the arachnoid is what? Subarachnoid space, where you find the cerebrospinal fluid. So if there's subarachnoid hemorrhage, that means the bleeding is here, in the subarachnoid space. If I say epidural, the blood is here. If I say subdural, where's the blood? Here. So it's more dangerous if the bleeding is epidural, because here you involve what? The meningeal arteries, while here it will be what? In subdural hematoma, it will be veins. You know the reason why it's more dangerous, because if you cut an artery or damage an artery, what? The pressure is higher, remember? And then it's like a sudden fountain of blood. Unlike if it's vein, it's what? Slowly bleeding, right? You understand? So watch out, be aware of the thing. So this question may come out in the nursing board exam. It's not just knowing that it is epidural, it's more dangerous, but being able to explain what? Why? It involves the meningeal arteries where the blood pressure is high. There is what? Faster what? Intracranial pressure elevation. And I shared this with, if you watch the video last Tuesday, I had a cousin who was 19 years, can you imagine, he was only 19 years old. And we are all cousins, we're all close to each other. So, and I was working as a resident physician, so he fell from the motorcycle that he was riding. So he actually walked to the hospital because it happened in front of the hospital. So he went inside, told the nurse, I fell, I have a severe headache. He started to vomit, like projectile vomiting, which is an indication of what? Increased intracranial pressure. He passed out, never to wake up. Then after 3 days, he died. Unfortunately, I was told on the second day. So when I went there, it was too late because he really had severe brain swelling, and I presume that he could have already developed brain herniation. Okay. Unfortunately, that was the time. This was in the 1980s, where there was no CT scan in the place where I grew up. There was no CT scan. And not only that, because at that time he was like the son of the governor, so nobody wanted to, he was a governor here, you know. So his father was a VIP, so nobody wanted to do surgery on him because there was also no neurosurgeon, right? there were a lot of general surgeons which had some training, because the only thing you could do is what? Drill a hole. Now, if you have no CT scan, what do? Drill a hole on the left, drill a hole on the right, drill a hole on the back, front, let the blood come out, right? Have you watched the episode of Grey's Anatomy? A couple of years ago, there was this guy, African-American, who got hit by a boulder, and there was an explosion in the pier. Remember the Grey's Anatomy is in Seattle, right? And this medical student intern, is Easy or something? The blonde hair? I don't know.
Yeah.
Easy? I don't know. Easy. So he was the one she was assigned to go there. But she could not bring the patient to the emergency room because I think there was a lot of boulders. So how do you know that there is damage to the brain and scalp? Because you talk to the guy, hi, how are you? My name is Robert Smith. I'm 22 years old, whatever. I think it was a middle-aged man. And then suddenly there is alteration in the level of consciousness. That alone will all brain involved. Does that make sense? So Easy had to think, what should I do? I cannot do a scan, but there is evidence of possible intracranial bleeding. So ask anybody with an electrical drill. And this is the pier, most likely everybody has a drill. So electrical drill, I think they only boiled the drill, and then and after maybe 1 or 2 minutes, the patient woke up. Where did you buy the drill, ma'am? I'm just joking. Save his life, okay? Now, let's talk about arthritis. In arthritis, there are many kinds of arthritis, right? What is osteoarthritis? Osteoarthritis involves what? The joints, right? What part of the joint? The articular what? Cartilage, right? It's because of wear and tear. Especially if you're obese and it affects the weight-bearing joint, the knee, the hip, okay, foot, vertebral column, and you end up with damage to the articular cartilage, right? That is what? Osteoarthritis, right? What about rheumatoid arthritis? It involves what? The synovium, or the membrane called synovium, which secretes synovial fluid. And then the mechanism here is what? Autoimmune, which means similar to MS, you have an infection, virus or bacterial, you have antibodies against the virus, any form of infection, like pneumonia, UTI, but because of your immune response that's very aggressive, it not only destroyed what? The bacteria or virus, but also started to destroy your what? The synovial membrane of your joints, like this, right? Now, can it affect all the joints? Yes, because the antibodies are in the blood. So that's why it's what they call symmetrical joint involvement. What does it mean? Left knee, right knee involved. Left hand joints, right hand at the same time. Unlike in osteoarthritis, left knee today, after 1 month, right knee later. And after a few months, left foot. So that's not at the same time. So this is symmetrical joint synovitis or inflammation. As time goes by, you have what? The development, have you heard of the word pannus? What is a pannus? This is seen in patients with RA or rheumatoid arthritis. Okay, you can read on these. Now, what about gouty arthritis? Gout. What's the problem? Uric acid, what? Crystals depositing within the joint. Can it also deposit on soft tissues like the skin? Okay, or in the big toe. It's called what? Tophus, right? What's tophus? Or tophi is what? Uric acid crystal deposition in soft connective tissues, right? Okay. So tophus or tophi, okay. Can this affect your kidneys? Can you deposit kidney stone made of uric acid? Yes, that's why it can lead to gouty nephropathy and eventually may end up with what? Chronic kidney disease or CKD and uremia, okay. So essentially, arthritis is inflammation of the joint, this and that, but different mechanisms. As a clinician, as a medical doctor, it is incumbent and imperative that we determine what's the cause of the infection. What is it of the inflammation? Does that make sense? Okay. So the idea, therefore, is that when you're dealing with a situation like this, as a nurse or a student of nursing, you should be able to establish what is the pathology, right? Because by doing so, then you can be able to determine what will be the mode of treatment, the nursing intervention that is necessary, right? Because you realize that you are working with doctors. The two of us, doctors and nurses, our goal is to treat and give the best possible treatment to these patients. Do you understand? Now, I think in your study guide I also mentioned the word psoriatic arthritis. Have you heard of psoriasis? These are patients who will manifest with skin lesions. Like, are you familiar with dandruff? Like dandruff on the skin, okay? And this also affects what? Patients with psoriatic lesions in the skin, leading to what? Psoriatic arthritis, which means that the skin is what? The joints are also can become inflamed, right? Okay. So psoriatic arthritis, I have friends who have this condition, and some people, if you look at this, like you know how this scales, like in this dandruff, you actually see them on the skin, there's red markings around it. And some people are very sensitive, and you can see the scales everywhere. Have you ever heard, remember on television, you have this, like, who is this golf player who has psoriasis, and he's being used as a model that, hey, I've been taking this medication, and there is some degree of did anybody read on the mechanism involved here? So apparently when you're dealing with psoriatic arthritis, you have to give the proper treatment modality, okay? Now, in RA, as I forgot to mention this, it's basically also autoimmune, right? And therefore, it also affects mostly women between the ages of 20 to 50, right? Autoimmune. That's the reason why, as I said, it's symmetrical, right? Symmetrical involvement. And in fact, when we do the rheumatoid factor test, the rheumatoid factor seen in RA is actually what? The antibodies. Does that make sense? Just like when you're on MS, we do a lumbar tap, get the cerebrospinal fluid. What do you expect to find in the cerebrospinal fluid? Antibodies. Does that make sense? Now, can anybody tell me what is another name for antibodies? Yes? Why are your faces like that, as if you heard this for the first time? Yes? Immunoglobulin, right? Remember? We have, we talked about this in one of the quiz, right? The chapter on IgA, IgE, remember? IgD, IgM, okay? So the first to be coming out from our immune system would be IgM. Then later on, most of the immunoglobulins would be IgG. What about the immunoglobulins coming from milk and secretions? IgA. What about the immunoglobulin involved in allergies? Asthma, IgE, right? But the idea, therefore, is that in a situation like this, like RA, the idea is that because of the involvement of these immunoglobulins, then as you can see, that it can actually what? Affect the patients. And these antibodies will be found in the joints, in the blood. And that's why when you do a rheumatoid factor test, you can actually see the difference, right? Do you understand? Okay. Now, as I said, what is common to all of them? Osteoarthritis. Okay, let me see if you remember. What's osteoarthritis? It involves what? Perfect. What about rheumatoid arthritis? The membrane. And what does the synovial membrane secrete? Synovial fluid. What about gout? Keyword. Hi, my name is gout. What is your name? If I shake your hand, hi, my name is gout. What is your answer? If I say, hi, my name is osteoarthritis, what is your name? Articular cartilage. If I ask you therefore, hi, my name is articular cartilage, what is your name? If I say, my name is synovial membrane, what is your name? If I ask for your name, my name is rheumatoid arthritis, what is your name? Synovial membrane. So if I ask you, what is the pathology of rheumatoid arthritis? It's inflammation of what? How can you not get a perfect score in a quiz? If you remember everything I say, right? And finally, gout, uric acid crystals, which is very important. Does that make sense? Okay? How many of you watch on YouTube when you're driving on the freeway? I not really watch. Now, you're not supposed to watch. You're driving, right? But do you listen? What, yearly? Does it help? It's called auditory learning, right? You like it? Yeah. I don't charge anybody, so it's free. So you better listen, right? How many of you? Only one in this class?
I watch it.
You can't watch while driving, please, okay? You can listen because is my voice strong enough?
Yeah.
Yeah, good. So you can listen. Can you imagine if you listen to that when you're making, driving and okay, instead of listening to music, okay, you can actually. The one on stroke, I think it was there, right? Okay. Okay, so we're going to have a short break, and after that, I'm going to get the quiz, okay? And
no break, evaluation.
No, not break. Actually, the
break from you.
Break from me, yes.